It's morning at NTV and we're live from Kampala's Swene Conference Center. I'm Andrew Chamagiro, Muntua Wansi. Now, one of the conversations that kept coming up in every time health workers go on strike is the issue of economic empowerment. We need to know, how do they expect quality service from someone who is insecure economically? Now, to speak to us about this and more, we have a Sister Annet Birungi from the Uganda Nurses and Midwives Union, who is also standing for Workers MP in the coming Parliament. Welcome to Morning at NTV. Now, Musa, I will start with, first of all, how have the nurses and midwives held up in this COVID-19 scourge?
First of all, the nurses outside there are not happy.
Why are they not happy?
Because this COVID-19 has brought a lot of effects to them. Yeah, we have handled other pandemics like Ebola, but this one in particular, really, it's more challenging because we are also dying.
Indeed.
And unfortunately, these other nurses who are in private sector, they have lost jobs. The nurses, every day, they live in fear. And economically, like for example, the transport, you know, we don't have accommodation.
Yes, indeed.
So transport has also gone up. And of course, the salaries remained.
The same.
The allowances are not there. And even if there is risk allowance, it's only going to those people who are right now working on COVID patients.
Okay.
And sometimes these allowances are also delaying. So the nurses actually, and midwives and all health workers outside there, they're not living.
The Minister of Health has always come out saying that, well, we have dispatched this money, it was dispatched, we signed and stamped, and this money should be given to the health workers. Do we have a communication gap between the Minister of Health and the last person to receive the money?
First of all, I think when you talk to the nurses who are supposed to receive those allowances, they will tell you we are in arrears all the time. So we don't know why. Yeah.
It never comes on time.
It never comes on time.
Okay. Now, we have seen stories of health workers who have not been paid since August. How do these people work in relation to what you've highlighted? So how do you work from August up to now? Do you still just hold the Hippocratic oath and you say, I'm still going to run by my oath regardless of no money?
Yeah, because, you know, the nurses are chosen by God. Our work is actually to save lives.
Yes.
So sometimes, even if the environment is not good, for you as a nurse, you feel you should continue working. So the salaries are coming on time. Actually, the system is well now. We get our salaries in time. But these allowances, which are supposed to motivate someone who is on duty, they are the ones that the system delay. And you start wondering whether really people think about the nurses outside there.
Now, there is a topic, now that brings me to the topic I understand you're very passionate about, and I'm equally passionate about economic empowerment.
Yes.
So how best can we economically empower the nurses and the midwives, or those in the health sector, the health workers? How best can we economically empower them? That while the salary is coming, but they're still economically empowered.
For me, I'm a nurse. I've been working in government for 15 years. And now I've also been a leader.
In those circles?
In those circles of trade unions. And right now, I'm the secretary for Women NOTU, National Organization of Trade Union. But at the same time, I'm the treasurer for Uganda Nurses and Midwives Union.
There's so much around money.
But what am I seeing in the community? That most workers do not have a side income.
Oh, yes.
And you find that if you don't have anything aside and you lose a job, it becomes a challenge. So when you go to the nurses as well, right now, the economy, the expenditures are so many. And now, if you are to spend your little money on the expenditures that you're supposed to, on the things that you're supposed to spend on, you find yourself in a crisis. So the nurses are also suffering like any other worker. Because of lack of side income. Because of lack of side income.
So how do you get there?
And I'm a nurse who have been working in Mulago, but at the same time, I've been having a small income. So I want a side income. I've been doing bedside nursing. I have a small company where at least if you contact us, we come to your home and care for you. So I've been organizing some nurses to do private work outside there. But at the same time, not myself working, but creating jobs for a few individuals around who are also working in government or in private, but doing something during their free time. And this is something I want to sell outside there, so that everybody right now has to do something aside, and we need to create awareness so that anything to happen to you, you should have something aside that can help you.
Okay. Now, Sister Birungi, I understand that is very pertinent, and I passionately respect that. Now, you're vying to be workers MP representing the ones in health, special health workers. What do you want to do for them that has failed to be done in the recent past?
I will go back to our nursing fraternity.
Okay.
The lobbying is in need. It is really demanding. You find that, like when I go back to economic empowerment, right now the president of Uganda promised us 1 billion to empower the nurses to do something, at least to empower them economically. It was a pledge.
Did you get that money though?
We did not get it up to now. So sometimes you can be working very well, but you feel there are certain things you feel you should lobby for other people, especially when you're a leader.
Oh, yes.
But you need that voice, you need that power, so that you don't just feel to help, but you should continue lobbying. So you have to look for the platform. So I really think that when I'm a member of parliament, I will help to lobby for the nurses and other sectors. In fact, I'm not aspiring on the position of workers MP. I'm specifically for women.
For women?
Yes.
Okay.
Female workers MP.
Okay. Now, going back to that, with the money the president had earlier on promised and it didn't come through, did you have a follow-up mechanism that possibly can follow up these pledges? Given that now you're going to be lobbying more, do you have, feasible follow-up mechanisms that could possibly follow up these, that they can materialize and they get to the person at the bottom of the pyramid?
A member of parliament, first of all, is supposed to advocate, to represent, to consult. So, to go back to the constituents and give feedback, budgeting and whatever. So, if I'm in the system, how do I fail to lobby for such a pledge?
They have always failed. That's what we're looking at. So how unique are you going to do? It
also depends on how you are vibrant and how consistent you are and what you feel for the workers. Most people do their own things. Most leaders have done their own things. You give them power, they reach and just do their own things. But as a nurse, I feel I can do better, because for us, we are for you. We are for people, you know that.
Oh, yes.
Yes. Even when you're in the hospital, you see everybody going, but nurses always remain. So I really think I can do better, because I'm a nurse who have been in leadership for a long time. And I know that if there is anything you want, you must put in a lot of effort. You must lobby, you must negotiate. So there, I think that platform alone helps. Because if you don't have a voice, if you are not heard, if you are just in the background, there's no way you can negotiate for the workers. Ourselves as Nurses Union, we've been lobbying. The president promised us this money around 2017.
Yes.
2018, things have been in the newspapers. 2019,
we talked about it again.
Nothing. Even recently, just last month before we stayed on the industrial,
he talked a lot about it.
We talked about it, and everybody is quiet. And we are not the only ones.
Even the teachers.
Outside there, the teachers and others, and other sectors, transport people have problems. And so I really think that we need leaders who can be very passionate in these things, and the nurse can do better.
Okay, Honorable, aspiring Honorable Annet Birungi, the issue, I love the fact that you represent the women, the issue of sexual harassment at workplaces, and you're representing women at work. The issue of sexual harassment, it has been amplified on an industrial scale over time. And they have never gotten a fair hearing, or they've been degraded if they go in courts of law. What is your way around this?
Right now, I think the workers outside there, one thing that the women lack is sensitization. They don't know their rights. National Organization of Trade Union have tried. Like as I told you, that I'm a leader at the national level. I'm the secretary for women. We've been trying to sensitize the workers. But still, it goes back to leaders. Because they are leaders with power, but they have not tried hard to put in systems to see that there is communication. Because if you get a problem at the workplace and you don't know where to report, I think it is also a problem. Communication gap. For me, I think we need to have report centers. We also need to have counseling centers. And we need to have focal persons.
In the communities?
Yes, in the communities at the workplace. So that someone feels that if I get a problem, I will first report to this one, and then the system will protect me also. Because if there is sexual harassment and you are also fearing to lose your job, it becomes a problem.
It's a juxtaposition.
So there is a need for us to communicate to the workers outside there that in case there is this and this and this about sexual harassment, the information goes like this and you are protected like this. So it has gone on and on because the leaders are not protecting us at the workplace. The policies at work, they are not implemented. There is also a problem of also men not being sensitized.
Oh, yes.
You find that everybody is trying to look for strategies to end violence against women, and sometimes men are not aware about it.
Oh, yes.
So we need also to bring some strategies, some programs, also targeting the men, so that the men can also feel it. But you find most workshops are all targeting women.
Women, yes, women.
Why?
Women, yes.
Because you are the people causing this.
Oh, yes.
So why are you not being targeted? And then majority of the workers outside there think that if you continue programming activities towards the women, the violence will be stopped. It's not possible.
Okay. Mrs. Birungi, let's talk about the first 100 days. What could be your first plan? Hypothetically, if you go through and you win the election, your first 100 days as workers, women, and now you've brought men on board. I need to look out for my wife, for my sisters and mother. What could be the first 100 days in a nutshell?
Wow, that's a good one, because I think I'm a person I'm a unifier. I'm a counselor. I'm an experienced leader. I've been in labor movement for almost 15 years. So one thing that I've moved outside the countries and I've seen how women protect others. And I've seen unions which are very, very strong. The last one I visited, I think it was in Australia, and I really saw committed nurses. I saw committed leaders trying to work for their people.
Oh, yes.
One thing that I want to see work is united, because it's unity. United we stand. Like here in this NTV, you workers, you need to be united. If you're not united, no work can move. Because when you're sick, another person will say, I can't work for you. Oh, yes. And the whole system will be broken. So Birungi Annet want to look at unity as number one. I want to look at effective representation. Effective representation, what do I mean? If people outside there are crying, if workers are going through difficulties, are you available for them? You must consult workers to know what is going on. Okay. But most MPs, actually, they don't consult us. We keep in isolation. I want to be there for the workers. Like, for example, during this pandemic, I've been sensitizing workers about prevention of COVID-19, and I need to see policies implemented. They are very good policies. We have very good laws. We can look for these bills and want to present bills, but what is it about the workers outside there? Effective representation, we need to be with the workers on the ground in order to know their problems, then come and represent them in parliament.
Okay.
But most people just stay in isolation. Lastly, I want to look at members who are workers who are rich. How are you going to represent people when you are poor? In fact, most people were asking me, how are you going to run your campaigns? How will you manage? How will you get fuel? I told them I'm a worker who have been working in Mulago, but also having side business.
So
you
you're
cannot
grounded.
sit down and you think that, look at this COVID-19. What has it done to us?
Campaigns.
We have lost jobs.
Yes.
Many people, they are now saying, you know, there is termination of jobs. Yes, they have terminated you, but have you been planning?
Oh, yes.
I also want to help people on how to plan on retirement. Like right now, I have a program that I've already started with other workers. During this COVID-19, we registered a cooperative. And the cooperative, we want to save the little we have so that we invest it, so that we help those people who have even lost jobs. I'm already working, and I really think I'm a woman who will empower others. We have one MP for workers, for female.
Oh, yes.
She's called Kunhira Agnes, you know her? Yes, she's right now, she has been looking at legislation most of the time, busy in parliament. So for us workers, we really think a woman should be a mother. We should have that woman that has touch
with
the community, and the nurse can do better. I think you can't you can't doubt that.
That is Sister Annet Birungi. Well, she's running for Woman Member of Parliament for Workers in the 2021 general election. So wherever she is, please, she has a point. So if you come from the school of thought where she actually stands in, 14th January, 10 days to go, that's the day.